Good morning, everyone. I'd like to start with a few quick updates. First of all, our business guidelines have been posted on stlcorona.com. These are guidelines for businesses that are planning on opening on May 18th. These are guidelines for social distancing, for disinfecting and cleaning procedures, and for crowd sizes. We know that a lot of our businesses are anxious to get started, and we want to help them in that process. We also know that a lot of our businesses aren't ready to open on May 18th, and we've heard from them. They want to wait, and we've seen this across the country. This is a slow, measured, and cautious rollout, and we expect to see that here in our community as well. They want to wait until they believe it's safe for their employees and their customers, and I think that's okay. Through the CARES Act grant, St. Louis County has set aside $17.5 million to help our small businesses that have been impacted the most by the stay-at-home orders. We've had over 2,000 or almost 2,000 applications for this grant. Our county council members are now going to prepare to review those grants and provide us with advice on who's been impacted the most and who has the most need. And the municipal mayors in St. Louis County will be providing input in that process as well. The deadline to submit grant applications is May 17. My administration is committed to make sure that these grant funds from the CARES Act, the federal stimulus, are spent in St. Louis County in a way that addresses all three of our crises: the public health crisis, the humanitarian crisis, and the economic crisis. This pandemic has taken its toll on many families. I've been to some of these food giveaway events in our community, and cars are lined up around the block. Their families will wait in line for hours, and some of them have small children in tow. In America, we really shouldn't have to worry about making sure families have what they need to eat, but that's the reality in our country, and that's the reality in our community. And it's even worse now than it has been in the past decade. Really, before this pandemic, before this epidemic, food insecurity was a real issue, but it's never been like it is today. We're fortunate in our region to have many organizations that do a great deal of work in providing food to families who need them. And we're here today to announce $2.6 million of grants to 5 of these organizations. They each have a long history of providing this service in an efficient and effective way, and we're going to help them with their mission through their network to make sure that the community, in our community, the families who need it most will have access to food. No child should go hungry, and we know that a child who's hungry doesn't do well in school and their growth is stifled. Families have to choose between food and medicine, and for our seniors, they have to choose between their utility bills and food and medicine as well. So here are some of the details of the grants we're awarding today. $1.3 million to Operation Food Search. Operation Food Search will offer free meals and distribution sites, 10 public schools and 10 libraries within St. Louis County between June 1st and the end of August. The St. Louis Area Food Bank will receive $755,000. The St. Louis Area Food Bank will distribute 40 to 60,000 meals per week at mobile distribution sites throughout the county. In addition, 45,000 meals will be distributed through 80 partner agencies in their community program. $500,000 to the Urban League of Metropolitan St. Louis. The Urban League will conduct events to distribute food and household goods to needy families from May 7 through the end of August. It will also distribute food and toiletries to seniors and the disabled community weekly until the end of December. $110,000 to Link Market. The Link will set up 4 pop-up weekly grocery markets in St. Louis County that will offer access to healthy, affordable food in food deserts. And the funding will also sponsor 400 vouchers and give a 50% discount to anyone who is using SNAP. $27,000 to pot bangers. Over 12 weeks, Bangerz will serve over 1,600 well-balanced meals to unhoused families and will deliver 2 weeks' worth of groceries and other essential needs to families in our community. So I'll ask any of these organizations who are represented here today can come up and say a few words. From Operation Food Search, we have Kristen Wild. From the St. Louis Area Food Bank, Meredith Knopp. Mike McMillan's here from the Urban League. I see Susan Rollins here from the Housing Authority of St. Louis County. Serena Bugett-Teague is here with Link Markets, and Cathy Daniels with Bangerz. Would you all like to say anything? Up here, I'll step aside. You can use the mic here.
Good morning.
Good morning.
Good morning. Very pleased to be here. As Dr. Page said, I represent Operation Food Search. We are an independent hunger relief organization with a mission to nourish and educate our neighbors in need to heal the hurt of hunger. And since the onset of the pandemic, we've been working in overdrive. The rate of food insecurity in the state of Missouri was 14% before the pandemic. It currently sits at 41%. There are many people who are going to bed hungry or not knowing where they will get their next meal or how they will feed their children. A lot of these individuals have lost their income and are facing food insecurity for the first time in their lives. Operation Food Search has responded by working harder to rescue food from restaurants, from farmers, from grocery stores, distributors, in order to supply the 200 agencies where we feed 200,000 people every month. We're also working with several organizations, including some that are here, such as the Urban League, Beyond Housing, Catholic Charities, in order to conduct large-scale drive-through food distributions that are feeding hundreds and thousands of families every week. We're also addressing the critical need to feed children while they have no access to school by providing grab-and-go meals at several St. Louis County Library locations and community centers, and emergency food packs at school districts and other community locations. We have a policy team that is analyzing the rapidly changing policy landscape so that we can help those that we serve to better understand the resources that are available to them, such as expanded SNAP and WIC benefits. We've been working with several organizations that have been assembled by St. Louis County in order to develop a cohesive and unified regional response to the pandemic. We are thrilled to receive this funding from the county through the CARES Act, and we're excited to supplement our current child meal program by providing meals to adults and full families at 10 library locations and 10 school locations. These meals are going to provide food to those who have lost resources and are unable to purchase food and have lost access to free meals at school. It's really these meals are going to provide nourishment, stability, and hope to thousands of people. We are deeply grateful, and we are excited to put this plan into place. For any information about Operation Food Search, about how people can get help or give help, they can visit our website at operationfoodsearch.org. Thank you very much.
Thank you. Thanks.
Good morning.
Good morning.
Feeding America estimates that there are 146,730 people food insecure in St. Louis County. That's almost 1/3 of the total number of food insecure individuals living in the 26 area counties served by the St. Louis Area Food Bank, and that was before the COVID-19 pandemic. With mounting job losses, furloughs, and kids being out of school for an extended period of time, those numbers have continued to rise. On average, we're seeing a 30% increase in demand since the pandemic reached our region. In March, the St. Louis Area Food Bank distributed 737,013 meals in St. Louis County. In April, we distributed 961,576 meals. That's an increase of 224,563 meals right here in St. Louis County. The St. Louis Area Food Bank currently has 58 mobile drive-through distribution events scheduled for St. Louis County in May alone. This list continues to grow each week as new distribution sites are being organized to address this increased need. In an effort to address the need and get food out quickly and safely, this generous grant is going to allow the food bank to conduct 10 additional mobile food distribution sites each and every week to get more food out quickly and safely to families. This will distribute 40 to 60,000 more meals each week just through these distribution locations. It will also allow us to provide additional food to the food bank's 80 partner agencies. These are food pantries, soup kitchens, and transitional housing units throughout St. Louis County. In total, this grant will help facilitate the acquisition and distribution of at least 85,000 meals each week to individuals and families right here in St. Louis County. Simply put, this grant helps us provide hope, food, and stability to children, families, seniors, and veterans right here in St. Louis County. Using our relationships in the food industry, we can stretch these grant funds and bring in food in bulk to maximize impact. In addition to shelf-stable items, the food bank also has access to foods such as fresh produce, dairy, proteins, to provide balanced, nutritious food to our neighbors in need. This grant also helps put local workers back to work and back on the job by allowing us to hire temporary, full-time employees to process and distribute this influx of food. The St. Louis Area Food Bank proudly serves St. Louis County and 25 other counties throughout the bi-state region. And just as we have been since 1975, we will be here to help feed and strengthen our region, regardless as to how long the recovery effort takes. Support from the community makes this work possible, and this generous gift helps us to get closer to providing our goal of 10 million meals by June 30th. We won't stop until our vision of a stronger, healthier, bi-state region where no one goes to bed hungry is a reality. If you're in need of assistance or would like to join us, please visit our website at stlfoodbank.org/COVID-19. Thank you.
Good morning, everyone.
Good morning.
My name is Serena Bugett-Teague. I'm the Community Engagement Coordinator for a small nonprofit called the Link Market. We've been in existence for almost 3 years now, and our mission is to provide healthy, affordable food to people who live in food deserts. We are really excited to have this opportunity to be in partnership with the county to provide vegetables and fresh fruits and staple goods to people in the community. We're excited to work alongside other great resources in the community. And if you have any questions for us or know families in need, please visit linkmarket.org and use the link to email us, or you can email me directly at Serena, SERENA, @linkmarket.org. Thank you.
Thanks.
Good morning.
All right.
It is truly a pleasure to be here today. I would like for everyone to please join me in giving our county executive a big round of applause and thanks for his steadfast leadership in this very difficult time. I also want to thank the county council, and I want to say job well done to you for a very immediate response. Well done is better than well said, so we appreciate you, and we thank you for your quick work. I also want to acknowledge Darrell Jones and James Clark and ask them to please stand.
Yep.
They are with the Urban League, and they have been working on the front lines as we have served 13,000 people in the past 6 weeks, providing over $600,000 worth of food to individuals in this community that need our help. We will continue these efforts, as the county executive mentioned, all the way until the back to school time. Then we will serve the community then by delivering directly to households. But as you look at this epidemic and you look at what we are doing, you see that 75% of the people that are going through our large distribution say that they have never ever been through a food line in their entire lives. So we in St. Louis have to do what we can to show the best side of ourselves, neighbors helping neighbors to make a difference. Because as Dr. King said before, the biggest question of our time is what are we doing for others? And today, we are doing these things in our community to help the people that are most in need get the resources that they need. Anyone who would like to get support from the Urban League can visit our website at ulstl.com. Thank you.
Thanks.
Good morning. My name is Cathy Daniels, known to many as Mama Cat. I'm the founder and CEO of Bangerz Feed the Body mission. Our mission is all about people, all about our unhoused and underserved families in St. Louis City and County. Every Thursday, we cook and we serve 150 meals to families, to people who are experiencing homelessness in our area. We are grateful for this grant that we may be able in this time of COVID to go ahead and serve so many more. We're grateful. We thank you, Mr. Page and the administration for stepping up right now. It's just like, we're really grateful. If you want any information on Bangerz, who we are, what we do, you can visit us at www.potbangers.org. Thank you so much.
Good morning. My name is Susan Rollins. I'm the Executive Director of the Housing Authority of St. Louis County, and I would like to also applaud Dr. Page, his administration, and the County Council for what they are putting forward today. I'm responsible for, and I say I am because I take it very personally, like many of you do who are working in these particular areas, for 6,700 housing choice voucher families, for 700 public housing families, and we also have low-income housing tax credit units, and they are at approximately 1,500 right now. So I'm responsible for a lot of families. And with Operation Food Search, we collaborated one summer to offer food to our children during the summer. And I will never forget a little boy who came up to me after he had one helping of food, and he said, "May I have another, please?" And I gave that to him, and he came up to me again, and he said, "May I have another?" And that shows us that we have been, for a very long time, in a situation where food is not available to individuals, where food insecurity is an issue every single day of the week. And I want people to understand, as others have said, that that was pre-pandemic. And now we're in a pandemic. And we're finding, as Dr. McMillan said, 75% of the individuals who are walking through those lines, driving through those lines, have never been in this situation before. And I think very often we forget that. We forget that there are people who are in need. We think that our community is perfect, and we don't even really acknowledge sometimes that there is a housing authority of St. Louis County, that something like that exists and is necessary for individuals to have housing. So thank you so much for putting this together, because without this and without linked markets and without those opportunities from everybody in this line, we wouldn't be able to take care of people. And if this pandemic teaches us something, let it teach us that we should not only be scurrying around during a pandemic, but after it's over, we need to make sure that we treat people in the same way that we're treating people now. We need to make sure that we have opportunities for people and create opportunities for people so that this doesn't happen again. Thank you.
Thank you, and thank you to all of our community partners as we try to put this CARES Act fund to use in St. Louis County. I'd be glad to answer any questions.
So maybe one of the appeal from like Food Search or Food Bank or Urban League, any of those three, the numbers are pretty staggering when you look at just how many people are in need right now. Why don't you just speak in general about the need out there at the current time and how much grant money like this can help fulfill that need for folks.
Yeah, Kristen or Mike, go ahead.
So just for people who might not be, in tune with it, good morning, how extreme are we talking here about the need for food during the pandemic, and how necessary are funds and grants like this we're talking about today?
Sure. Funding such as this from Dr. Page for St. Louis County with the CARES Act is transformational. As all of my colleagues have said up here, the need is real. The need was here before the pandemic hit, and so we know that food insecurity is real for our seniors, our families, and our children. And now with so many people losing their jobs, it is a real problem now for thousands and thousands of people across the St. Louis County area that have never had to ask before. And this is going to go on for a long time. We're very grateful that people are starting to think about opening up again when it's safe for them, but it is going to take a very long time for the recovery. So it's organizations that are represented here today that are coming together, collaborating, and working together to serve and strengthen and uplift St. Louis County and all the counties that we serve.
And that's got to be troubling because it's not like this is going to go away on May 18th.
We wish that it would. We wish it would be as easy as flipping a switch. I think if any of us could, we would, but it's not. We are all making plans for the long term. With this grant money, it takes us through summer and beyond. I know at the St. Louis Area Food Bank, we're making plans through the end of the calendar year and beyond that, so we can be here to support our neighbors in need. Thank you.
Thanks.
Dr. Page, I know a lot of people are looking forward to the reopening process starting on Monday, including businesses and individuals. We know some gyms cannot open, but I'm hearing that there's a petition for some yoga studios and some small studios to open. Would that be something you consider? Why or why not?
I would look to the guidance from my public health department, medical experts, doctors who are setting our standards and determining what is an area of high risk for COVID-19 transmission, and I would let that drive the conversation. These are all made based on medical science, not my opinion, not another person's opinion, but standards that are set by medical experts about where there's high risk of COVID transmission and how that can be lessened through social distancing and other measures. And as we move through this first step, we're going to focus on areas where we think that risk of transmission can be balanced with getting the economy moving forward in a safe way. And we're going to focus first on keeping people safe and maintaining their health, but always an eye on trying to slowly and cautiously get the economy moving again.
Dr. Page, you and Mayor Kristen have both spoken about the need to expand testing as we get closer to the reopening. Can you speak as specifically as you can about how many tests have been done in St. Louis County so far, how that compares to when this started, and where this testing environment is going? Are we making progress?
Yeah, well, we're in a national testing shortage, and St. Louis County is competing very aggressively. I know St. Louis City is as well, and our other jurisdictions to try to get tests here in the region. And we've had some tests donated as well. We've had 20,000 tests so far in St. Louis County. About 16% of those have been positive, and we expect that to change, that percentage to change moving forward as we expand testing to everyone who's symptomatic and not just high risk. And in some hot spots in the community, we're going to be testing people who are asymptomatic. And as we move forward, we hope that everyone who wants a test can get a test. Right now, because of the national shortage, in some areas that is limited somewhat, but we know that a robust testing environment of everyone who is symptomatic is very important in moving forward to the next stage. Contact tracing is very important, so we can focus on the people who are COVID-19 positive, to get them taken care of, to make sure they're isolated, to make sure they have what they need to isolate at home whenever possible, and to make sure we find everyone who's been in contact with them so they can get the proper advice and be quarantined if necessary.
Do you feel like you're making progress in the right direction?
Yeah, absolutely. We put out a bid earlier this week for 100,000 tests. We're in the process of going through those results. We had 6 people respond. We're going to put in an order for those tests, and then we're going to open up bidding again, and we're going to continue to do that, and we're going to get as many tests as we can in the region. That's a very important part of our recovery, so we can focus our efforts on people who are infected and their close contacts and begin to relax the stay-at-home orders gradually and move forward in a very thoughtful way, in a very cautious way, to manage this virus and try and limit as much as possible any steps backwards.
I just have one more big picture question too. When we talk about, when Dr. Garza speaks about the numbers going down a bit, being past the peak, hospitalizations being down, you've spoken about progress too.
Right.
Where do you feel like we are big picture in terms of, perhaps for lack of a better term, containing the virus? Do you feel like it's contained in the area? Do you feel like we have a handle on it? Where are we big picture, do you think, in battling this thing?
Well, St. Louis was hit particularly hard, just like any urban center in the country. We initiated our stay-at-home orders earlier than the rest of the state, and we believe we benefited by that, and that's why we're in the position that we are now. But we also had to extend our orders because of how hard we were hit, and we think we made the right decision to extend those until the 18th. We're watching hospital admissions drop. We're watching hospitalizations, ICU stays, ventilator usage drop. And we believe that our hospitals now have the capacity to manage their COVID-19 patients. And that is one of the keys to considering reopening. Being able to manage the hospitalizations, being able to suppress the virus spread in our community, which we have done, and creating an adequate testing and contact tracing environment. And as we do that, then we are prepared to slowly and cautiously and thoughtfully begin to ease our social distancing orders. Any other questions, Doug? Okay. Thank you. Thank you, everyone. Thank you to our community partners. This is a big deal.